So, hi, I'm Dr. Wilfred Miyasaki of a Downtown Dental Group. I practice right in Honolulu. And in my practice, I get a lot of questions about implants. And of all the questions, the two most common questions I get are, how much do dental implants cost in Honolulu? And are dental implants right for me? Well, this prompts a lot of people to go to the internet to get some information. But there is so much information on the internet that it can be very confusing and often frustrating just to find the answers to these very common questions. So what I've done is I've made a short video just to answer or give you more specific information regarding these two common questions. But before we start, this is a complex subject. One size doesn't fit all. There are many options available besides implants. So most people are good candidates for implants, but not everyone may qualify. So I have also prepared some other options that people can use instead of implants too. So before I go into the video, I have a few questions for you. What's most important to you about implants? Are you embarrassed about your smile? Do you have gaps between your teeth or missing teeth? Or are you primarily concerned about function, about chewing and eating the foods that you love? The two most common complaints I get from patients regarding implants are, well, for once in their lives, they want to have a smile they will not be embarrassed about. And number two, they cannot eat the foods they love or need for healthy nutrition. And missing teeth affects what we eat every day and greatly affects our daily lives both socially and emotionally. No wonder missing teeth affects our lives so much. After all, we use our mouths for many things every single day. We eat, we talk and communicate, we sing, we laugh, and we kiss. And what happens when we lose teeth? Well, the bone loss around teeth is immediate. Once you lose a tooth, you lose bone that supports the teeth. And this bone loss is progressive. 40 to 50% of the bone or the ridge around the tooth is lost after only 6 months. And this loss is irreversible. It affects the way we look. The face can collapse. There can be wrinkles developing around the mouth. And due to loss of muscle tone, sometimes there could be some pain. And the bone just keeps disappearing and deteriorating over a long period of time. And missing teeth causes reduction in chewing ability and function. Dentures and partial dentures only give us about 20 to 50% of natural tooth function. Also, a reduced function equals an increase in soft, starchy food intake due to difficulty in biting and chewing. Dr. Charles Mayo of the world-famous Mayo Clinic said, people who keep their teeth live an average 10 years longer than people who lose their teeth due to poor nutrition. So have you ever wondered what it would be like to smile with confidence at the people you love? What would it be like to eat your favorite food without pain or embarrassment? And how would you feel to look 10 or 20 years younger? So today, you will learn the 5 simple steps to having a beautiful smile, the benefits of dental implants, and why partial dentures don't always work, why one size does not fit all, and how to reclaim your smile and get your life back. So there are options. Fortunately, today's dentistry offers numerous options for replacing of missing teeth. However, only one option, dental implants, has been determined to be the standard of care. The other options are, of course, if you've lost all your teeth, dentures. Or if you still have some of your teeth, partial dentures can be an option. Or even fixed bridges. But in modern dentistry, the best option is dental implants. Of all the different options that exist today, only dental implants will stop the bone loss. It'll stop teeth from shifting, it'll increase your biting power, and it will not affect healthy adjacent teeth. And are dental implants expensive? Well, this is what we all wanted to know. Well, fees will depend on a number of things: the number of implants needed, the severity of bone loss and the quality of the bone, the type of replacement teeth. If lowest possible cost is your primary concern, implants may not be for you, but other options are available. So what do dental implants cost in Honolulu? Now, there are many things that will influence the cost, but here are some of the general guidelines. There are two parts to a typical dental implant: the implant itself, which is the artificial root, and also the crown that fits over the implant. So, the cost of placing a single dental implant in Honolulu, which includes only the surgical placement of the implant, ranges in cost from about $1,800 to about $2,900 in Honolulu. Some places charge over $3,000 for this. Our dental implant placement fees are about $1,900, which is an excellent fee. You never want to pay too much. The cost of a single dental implant in Honolulu, which includes both the implant placement and the crown that fits over the implant, ranges in Honolulu from $3,800 to about $4,800. Some places charge over $5,000 for this. Our dental fees for doing both of these procedures combined is about $3,885. Again, this is an excellent fee. And what is the cost of small body dental implants in Honolulu? This small body implant system is also known as mini implants because they are smaller than the regular or standard size implants, but they are ideal for special situations where regular implants don't fit, such as not enough space for a regular implant, or to replace smaller lower front teeth. It's good for a medically compromised patients who are not a good candidate for the more extensive surgery for a larger implant. Also, to hold a loose lower denture in place. This is a common use for it. Also, to make a partial denture more stable. Small body or mini implant placement is about 1/2 the cost of regular implants and is usually under $1,000 each. They are most often used to secure a loose lower denture so they won't move around when you eat. And the cost of both a small body implant and a crown, if necessary, is usually under $2,000. It ranges from about $1,900 to sometimes about $2,100. But they are for special situations only. But if appropriate for you, it can be a huge savings. So this is a complex subject. One size does not fit all. This is why we recommend an exam and a consultation to determine what is right for you. We will customize a plan just for you. Implants are a great solution, but may not always be the ideal solution for you. There are many options, and we will help you determine what is best for you. So you give us a call at 533-0000 for a free consultation today. But we do have a limited number of spaces available, so only about 4 implant consultations are given out per month. But so reserve your appointment now. This is a huge value. So what to do now? There are 5 simple steps to a new smile. Make an appointment for a consultation. We will take x-rays and compile some records for you. Then number 3, we will create a personal treatment plan just for you and discuss any cost involved. Once we determine that, we can start your implant procedure. And number 5, finally celebrate your new smile. And finally, people with dental implants do tell us they feel better, look better, and live longer. It can be a life-changing experience for them. They can once again talk, laugh, and eat comfortably with family, friends, and coworkers, and no longer feel hostage to their teeth. And they all say the same thing: I wish I had done this sooner. So, once again, I'm Dr. Wilfred Miyasaki of a Downtown Dental Group. I hope this has been helpful, and thank you for listening.